Okay, so today we're gonna have a look at anesthetics, and if you can imagine, back in about late 1700, this is where the picture was actually drawn. Yeah, it's a picture of a man having his leg amputated, and you can see that there is this one big guy here, yeah, with a saw that's simply sawing off his this poor man's leg on and off, on and off, and you can see the look of horror on this man's face when he can actually see and feel how the saw is just cutting off to slowly, yeah, getting to the flesh and then his bones and so on. And all of this, I mean, the amputation of the leg, this example, was being done without any painkiller, without any anesthetic. Imagine the great pain. Yeah. When anesthetic was actually discovered, it's a miracle drug in a sense. You can do a lot of things. A lot of procedures, operating procedures, can be done with anesthetic. Yeah? And this is actually this is the word anesthetic in Greek, and it means lack of feeling, lack of feelings, or insensitive. Yeah, but in the current medical term, anesthetic means a group of drugs that induce absolute loss of consciousness or sensation. So there are two categories of anesthetic. The first one would be the inhalation anesthetics, and the second one would be the intravenous anesthetic. For inhalation anesthetic, it is subdivided into chlorinated hydrocarbons, volatile hydrocarbons, nitrous oxide, and fluorinated hydrocarbons. I put on this cardboard. Sorry, this is postcard, not a cardboard. This is a postcard of a drawing, yeah, that depicts the concept of. It's quite interesting. Yeah, a concept of a scientist. This is the scientist. Yeah, using a steam distillation machine, okay, with a pulley, all right, to pull off or to extract a tooth from a man. And there was a belief back then, in around 1800, around that time, that a mechanical procedure to extract the teeth would be painless. Yeah, you just pull out quickly, sharply the tooth. So that was the thought back then. Okay, and then around the same time, there was also this observation by a dentist called Wells. That happened during the demonstration of popular science, around that time, and he observed that one of the demonstrator was quite high on nitrous oxide, and you know how, if you've seen some cartoons, some videos, that if you actually take in nitrous oxide, your voice will change. And it so happened that this demonstrator fell off and cut his leg, and this is all under the influence of nitrous oxide. And somehow, this demonstrator, the one who is high on nitrous oxide, just got up again, rubbed off the dust, and continued demonstrating. And Wells, the dentist, said that the man is not bothered by the big wound, so he thought that it might be painless. So he was thinking that could he actually use nitrous oxide, yeah, to reduce or to remove the great pain associated with tooth extraction. You see, nobody wants to go to the dentist anyway, yeah. So around that time, 1800, maybe early 1900, nitrous oxide was considered as the miracle drug, and a lot of people actually will announce it as a new era in tooth pulling. Okay, let's have a look at this famous nitrous oxide. Yeah, it is known by other names as nitrogen oxide or dinitrogen monoxide, or a laughing gas. A laughing gas, like people who actually under the influence of nitrous oxide would be so excited, would be so happy. Yeah, it is the weakest, yeah, but the safest inhalation anesthesia at that time. Yeah, the things that patients who were actually under the influence of this nitrous oxide could get bouts of hysteria. The good things that um, it also lead to rapid recovery. Once you pull teeth, it is the influence of this nitrous oxide gas simply wear off quickly.